What is the position of right and left renal pelvis in relation to the lumbar vertebrae and transpyloric plane? The left renal pelvis is at the level of body of first lumbar vertebra and lying on the transpyloric plane, while the right renal pelvis is at the level of intervertebral disc between the first and second lumbar vertebrae and lying slightly below the level of transpyloric plane. Name the muscles which are related to the posterior surface of each kidney. Psoas major and quadratus lumborum. Which ribs protect the left kidney from behind? 11th and 12th ribs. The pair of nerves which come in direct contact with the posterior surface of both kidneys is the right and left subcostal or 10th intercostal nerves. The hilum of the right kidney is anteriorly related to which structures or organs? Vertical or second part of duodenum and the head of pancreas. The hilum of left kidney is anteriorly related to which structure or organ? The tail of pancreas and splenic vessels. What is the position of renal vein at the hilum of kidney? It is the anteriormost structure leaving the kidney. What is the position of the renal pelvis at the hilum? It's the posteriormost structure leaving the kidney. Which connective tissue layer covering the kidneys is also known as false capsule? The renal fascia of Ureter. What is the functional significance of fascia of Ureter? It acts like a limiting membrane and prevents the spread of any renal tissue infection or cancer in the initial stages. What do you call the collection of brown adipose tissue around the kidneys? The perirenal or perinephric fat. What do you call the collection of wide adipose tissue present at the posterior surface of kidney? The paranephric or pararenal fat. What is the functional significance of paranephric fat? It holds back the kidney in its normal anatomical position, anchored to the posterior body wall. What happens in case of loss of paranephric fat? A condition known as renal ptosis occurs, in which the kidneys drop down to a lower level. In case of renal biopsy, the biopsy needle will penetrate through skin and subcutaneous fat, deep fascia, quadratus lumborum, paranephric fat, renal fascia of Ureter, perinephric fat, renal capsule, and kidney tissue. Name the 3 distinct regions visible in a longitudinally sectioned kidney. The outermost pale region known as cortex, the intermediate darker region known as medulla, and the innermost pale region known as renal sinus. Define a renal pyramid. It is a triangular segment of the renal medulla, mainly composed of vertically running collecting ducts. What are the renal columns? These are the vertical extensions of the cortical tissue into the substance of medulla. These columns divide the medulla into 5 to 8 pyramid-shaped regions. What is a renal papilla? It is the tapered off apex of each renal pyramid which opens into the minor calyx. What is the duct of Bellini? It is the largest of all collecting ducts that is formed by many smaller ducts, and it opens into the area fibrosa of the renal papilla. Define a renal lobe. One renal pyramid along with its adjacent cortical cap is known as a renal lobe. Name the parts of a nephron. A renal corpuscle composed of a glomerulus and Bowman's capsule, and a set of renal tubules composed of the proximal convoluted tubule, loop of Henle, and the distal convoluted tubule. How many types of nephrons are present in the cortex? Two types, cortical, 85% with short loops of Henle, and juxtamedullary, 15% with very long loops of Henle. A hallmarking histological feature, the brush border, is present in which part of the renal tubule? In the proximal convoluted tubule. What are the juxtaglomerular cells? They are the modified smooth muscle cells present mainly in the tunica media of afferent arterioles. What are macula densa cells? They are tall columnar cells present in the wall of the distal convoluted tubule. Which important substance granules are present in the macula densa cells? Renin. The juxtaglomerular cells of afferent arteriole act like mechanoreceptors and sense the pressure of blood. The macula densa cells act like chemo or osmoreceptors and sense the change in solute concentration. What are the structural elements of glomerular filtration membrane? The glomerular capillary endothelium, podocytes of the visceral layer of Bowman's capsule, and the fused basal lamina of capillary and podocytes, known as the glomerular basement membrane. What is the hallmarking microscopic feature of the glomerular capillaries? They are fenestrated and the pores are not covered by diaphragm. At which vertebral level the two renal arteries are arising from abdominal aorta? At the level of first lumbar vertebra, just below the origin of the superior mesenteric artery. How many segmental arteries have been given off by the two divisions of renal artery? Total 5, 4 anterior and 1 posterior. Name the 4 anterior vascular segments of the kidney. Apical, anterior superior, anterior inferior, and inferior. Name the branch of renal artery lying at the medulla cortex junction. The arcuate artery. Afferent arterioles are given off in the cortex by which branch of the renal artery? The interlobular branch. In what way the venous pattern of the kidney is different from the arterial pattern? There are no lobar and segmental veins. The interlobar veins directly join each other to form the renal vein. What is the position of renal vein at the hilum of kidney? It is the anteriormost structure. What are the main differences in the afferent and efferent arterioles? The caliber or lumen of afferent arteriole is larger than the efferent arteriole. The tunica media of the afferent arteriole is thicker than the tunica media of the efferent arteriole. What is the unique feature of the glomerular capillary bed? It is a pure arterial bed, both fed and drained by arterioles. What is the main function of the glomerular capillary bed? filtration of blood. What is the name of the other capillary bed of the nephron? The peritubular capillary bed. What is the main function of the peritubular capillary bed? Reclaiming or reabsorption of the glomerular ultrafiltrate. 99% of the filtrate is reclaimed. The peritubular capillaries originate from the efferent arteriole. The peritubular capillaries drain into the interlobular veins. What is the point of origin of each ureter? It originates just below the hilum as the downward continuation of renal pelvis. While descending down towards the bladder, the ureters are lying on which muscle of the posterior body wall? Psoas major. What are the 3 points where the ureter shows its normal anatomical constrictions? At the uretero-pelvic junction where it originates, at the pelvic brim where it crosses the bifurcation of common iliac artery, and at the uretero-vesical junction where it enters the wall of the urinary bladder. What is the functional significance of these normal constrictions? They prevent the retrograde flow or reflux of urine towards the kidneys. Which structure anteriorly crosses the ureter in the female pelvis? The uterine artery. Which structure anteriorly crosses the ureter in the male pelvis? The ductus or vas deferens. Name the 4 walls or surfaces of the urinary bladder. Superior wall or fundus, right inferolateral wall, left inferolateral wall, and posterior wall or the base. Which wall or surface of the bladder is covered by pelvic peritoneum? The superior surface or fundus. Which structures are related to the base or posterior wall of the bladder in males? Seminal vesicles and vas deferens. Which structures are related to the base of the bladder in females? Uterine arteries and ureters. What is the lining epithelium of the bladder and what are its special features? Transitional epithelium, also known as urethelium. The cells of this epithelium are highly stretchable and linked to each other through tight junctions, which prevents the seepage of urine into underlying structures. What is the name of the muscle making the walls of the urinary bladder? The detrusor muscle. It is a huge collection of smooth, involuntary muscle fibers. Define the trigone of bladder. It is a smooth, triangular region present inside the base of the bladder. It is smooth because the mucosal lining is adherent to the muscular wall. Name the openings related to the trigone. The base of the trigone receives the ureteric orifices on either side, and the apex contains the internal urethral orifice. Which nerve fibers are responsible for the emptying of bladder? The parasympathetic fibers, by contracting the detrusor muscle and relaxing the internal urethral sphincter. Which nerve fibers are responsible for the filling of bladder? The sympathetic fibers, by relaxing the detrusor muscle and contracting the internal urethral sphincter. Which nerves contain both the afferent and efferent limbs of the micturition reflex arc? The pelvic splanchnic nerves. What is a neurogenic bladder? It is a condition where there is abnormal retention of urine in the bladder due to loss of picturation reflex as a result of damage to the sacral segment of the spinal cord. As the root value of the nerves of emptying, the pelvic splanchnic nerves is S2, 3, and 4. In case of an injury to these roots, there would be paralysis of the detrusor muscle and the internal urethral sphincter. The unopposed sympathetic stimulation will cause relaxation of the detrusor muscle and contraction of the internal urethral sphincter, leading to urinary retention. What are the lengths of male and female urethra? The male urethra is 18 to 20 centimeters long, while the female urethra is 3 to 5 centimeters long. Name the 4 parts of male urethra. The first part, known as prostatic urethra. The second part, known as membranous urethra. The third part, known as bulbar urethra. And the fourth part, known as spongy or penile urethra. What do you mean by posterior urethra? The prostatic and membranous parts of male urethra together are known as the posterior urethra. What is the motor innervation of the external urethral sphincter? Pudendal nerve with the root value of S2, 3, and 4. Where does the female urethra terminate? It terminates within the vestibule in front of the vaginal opening. Why the urinary stress incontinence is more common in females as compared to males? In females, the external urethral sphincter is only partially developed. Therefore, they have less ability to hold back the urine for longer hours.